How do you counsel residents who
Yeah.
are not sure? Maybe they do think it's interesting to do head and neck pathology, but they don't know if they could do that full time and get through all the schooling. What would you
Uh,
say?
yeah, I think it's a very common question that I get, and it's a very personal one. And there are many factors that plays a role. What kind of path after residency you take? Do you do a fellowship or you don't do a fellowship? And if you do a fellowship, what kind? Craniofacial, cosmetics, or head and neck? And if you go into private practice, what are the reasons to go to private practice and stuff like that? So I tell the residents there, like if they're not decided, one thing is first you have to decide if you want to do a fellowship or not, right? That's one thing, right?
Yeah.
The other thing is like if you have not decided doing a fellowship, and then that's totally fine. You don't have to do a fellowship. That's what I tell people. Like, don't do it because of emotions. Don't do it because you see someone they're doing it, unless you're inspired by it. Unless it's your passion, do it. Because if you do it just for a reason, just because, oh, it's another year and it's cool or something like that, and then you don't enjoy it, you don't get to do what you want to do, or financially it's not stable, it's challenging,
Yeah.
it will be very difficult. So first of all, you have to decide why are you doing it. I had a passion to head and neck. That's why I did before I did my residency, I knew I wanted to do head and neck. So for me, it was very easy decision, and for some people, it's not. I mean, when I didn't have that many loans for college. Only loan that I had was for dental school and the medical school. And I understand that when people are coming out of residency, they have like half a million, close to
Yeah.
$1 million loan. So that is a major factor. That is a major factor that people think that it would be difficult for them to go for another 2 years, not have an income,
Mm.
and invest that time. And rather than making money and paying loans and have that interest, I mean, I think that's a main factor these days, and quality of life that influences your decisions.